Alright, so now we're going to end up this chapter looking at the different types of blood vessels as far as what they look like structurally, different layers involved and so forth, as well as what they do. And then finally, like I mentioned before in the previous sections, we're going to take a quick look at the lymphatic system and see how that kind of pairs up with the circulatory system to help to ensure that things run smoothly. So as we've seen before, I've mentioned some of these terms before throughout this chapter's lecture on circulatory, but the blood leaving the heart is going to exit through what are known as arteries. So again, arteries are always away from the heart. And for all except for the pulmonary artery, these blood vessels are going to be carrying oxygen-rich blood. From there, the arteries are going to branch into what are called arterioles, which are smaller versions of arteries. They are structurally similar. They carry the same kind of blood, more or less, only they're smaller diameter, and there's a lot more of them. Right? So these are going to branch out from the arteries into arterioles, and from there, we're going to go into capillaries. The capillaries are a critical part of the circulatory system because this is where the actual exchange occurs. Gas exchange across capillary walls, nutrient exchange, waste exchange, hormone exchange, all those kinds of things are happening across the capillary walls. If you think back to our chapter on animal organization, homeostasis, you remember that capillaries are made up of only a single layer of squamous epithelial cells. They're very, very thin, single layer thick, and that really kind of makes sense if you think about it, because if you want to have exchange occurring, if you want to have movement across the walls of the capillaries, you really sort of need them to be relatively thin. From the capillaries, we then go into venules, which are small versions of veins, and then into the veins themselves, which are going to help carry blood back to the heart. And again, for all except for the pulmonary vein, these vessels are going to be carrying oxygen-poor blood. So that's kind of the last step in the circulatory system, getting back to the heart. For both arteries and veins, but not capillaries now, just arteries and veins, we have 4 different tissue layers. There is the endothelium, there are elastic fibers, there is smooth muscle, and there is connective tissue. And that's going from the inside out. So the part in contact with the blood itself is called the endothelium. The next layer moving outwards are the elastic fibers, and then smooth muscle, and then connective tissue. Now, one thing you should point out here too is that these, because they have all 4 layers of these different tissue types, the walls are much too thick for any sort of exchange, even for gases to occur across their walls. Capillaries are much more well suited to having that exchange because they're, again, composed of a single layer of those endothelial cells. I should also point out too that arteries and veins, although they both have all 4 tissue layers, the emphasis on the different tissue layers differs depending on which type of vessel you're talking about. So for example, arteries have much more in the way of smooth muscle and much more in the way of elastic fibers than do veins, because arteries are subjected to more stresses. Pressure coming out of the heart at the arteries is much higher, so you would expect them to have a bit more in the way of structural strength. Capillaries, though, again, as they're very thin, have that single endothelial layer, really good at allowing for exchange of things between the blood and various other cells out in the tissues. So again, looking at movement of things going out from the heart out to the rest of the body. So we have an artery leaving the heart from the left ventricle over here. The aorta is kind of coming down behind here. We have arteries. We have arterioles branching off of the arteries. We then get into capillaries, which is where the exchange occurs. So capillaries, again, very, very thin, versus, say, an artery, which has these very thick walls, and even arterioles, which have somewhat thicker walls, even with smooth muscle at least, if not just endothelium, there's also smooth muscle there. From capillaries, we then go into the thicker venules, and from venules we get into veins. But again, if you look at the amount of material devoted to different layers in, say, an artery versus a vein, arterial walls are much thicker. And in particular, the layer of smooth muscle, the layer of elastic fibers, is substantially thicker here than it is over here in the venule. And again, that's due to, or in the vein, sorry, in the vein. That's due to the different stresses involved in arteries versus veins. Again, kind of the pathway of blood flow here. We've got cross-section of an artery. We have what are called precapillary sphincters, so these can be closed. If these are constricted, that's going to help reduce or maybe even keep blood out of these capillaries altogether. If they're dilated, they can allow blood into those capillaries. And so across these capillaries, again, simple squamous epithelial layer in those capillaries to allow exchange to occur. Eventually, we get back into the venules, and from the venules back into the veins. So again, artery, arteriole, capillaries, venule, vein, back to heart. Different layers again, like I mentioned a few minutes ago. We have endothelial layer on the inside. We then go to an elastic layer here, a layer of smooth muscle, and then a layer of connective tissue all the way on the outside. So that's for an artery. If we look at a vein, all 4 layers are there, but in different proportions, especially when you look at smooth muscle, how much there is over here versus how little there is over here. That's going to play a pretty big functional difference when it comes to how these are going to function in arteries versus veins. Capillaries, again, different types of capillaries, but the overall main feature here is they're very thin-walled, very narrow diameter, and very good at allowing for exchange to occur across the walls of those capillaries. So again, the bigger arteries, they're the ones that are getting the most pressurized blood. They're going to have the most elastic fiber and the smooth muscle. So they're going to be able to expand and withstand some of the stresses of this as we experience blood leaving from the heart. Vasoconstriction is a situation, we've used that term before. This is where arteries and arterioles in particular are going to be constricting that smooth muscle layer to help increase blood pressure, for example, inside the arterioles and arteries in response to various stimuli. We can also take a look at what's called chronic vasoconstriction, which can lead to high blood pressure, which of course has all types of negative connotations associated with it as well. It can be, in the long term, very damaging to the body, various organs, tissues, and so forth if blood pressure is to remain too high for too long. The opposite of vasoconstriction then would be vasodilation. And so this is now when those smooth muscle layers in the arteries and arterioles is relaxed. It's going to allow blood to move more smoothly and blood pressure to drop because now the tube is essentially bigger. We talked before about those precapillary sphincters. In the case of vasoconstriction up here, this is what might happen if you were in a relatively cold situation. You want to keep blood closer to the core. You want to keep blood away from the skin where it's going to be relatively cold and where you might tend to lose more body heat. By constricting these precapillary sphincters, we're going to keep blood out of these capillaries to some degree and allow heat to be conserved. The opposite then would be true if those precapillary sphincters were relaxed. That would allow blood to flow closer to the surface of the skin and allow us to dump heat out in the environment more like a radiator would do. We can take a look also at some conditions of the cardiovascular system that might be abnormal or harmful in some way. Aneurysms are where the walls of an artery is weakened. It actually swells outward. It provides sort of like a little bump. And the biggest risk that could occur here is if that were to break, since we have a weak spot in the walls of the artery or arteriole, it could actually cause a break and then bleeding out into the surrounding tissues. Capillaries, like I mentioned, despite the fact that they're very, very thin, we actually have more cross-sectional area of capillaries than we do any other type of vessel because we have so many of them, despite the fact that they're relatively small and relatively thin-walled and each one by itself is not that big. The sheer number of them means that we're going to have a huge amount of cross-sectional area of capillary in our bodies. And so the primary benefit here, in addition to having them very thin-walled for exchange of materials like we talked about before, is that when we're pumping blood through this huge network of very, very tiny vessels, that's going to help slow down blood flow. And that's really, again, something you want to have. You want the blood flow to slow down at the capillaries so that there is time for exchange to occur. We want there to be time for O2 to go from the capillaries out to the tissues. We want there to be enough time for CO2 to go from the tissues into the capillaries. So by pushing this relatively large volume of blood into a very, very large network of very tiny tubes, that allows for more time for exchange to occur in the capillaries. So that's going to be kind of a big benefit of having them so small. One of the other things that's maybe kind of an unintended consequence of how our circulatory system is set up is that if you look at capillary walls, right, very, very thin, single layer, simple squamous epithelium, red blood cells are almost as big as the diameter of the capillary itself. So when you get into the tiniest capillaries, they're actually going one by one, single file through there. Because the blood coming into the capillaries is under relatively high pressure, and because the walls of the capillaries are so thin, it is inevitable that there's going to be some leakage of fluid from the capillaries out into the surrounding tissues. So it might, and for the most part will be, just blood plasma, maybe a few proteins in there as well, certainly not blood cells, but we're going to be leaking some of the material of the blood out into surrounding tissues. And what we're going to see here in a few minutes is the importance of the lymphatic system and getting that material back into the circulatory system where it belongs to maintain adequate amount of blood volume and so forth inside the circulatory system. So again, we can look at both velocity and area, right? So if we look at velocity in the aorta, arteries, arterioles, capillaries, what does it do? It starts out relatively high in a really large tube called the aorta, highly pressurized coming out of the heart. The velocity is going to slow down a little bit by the time you branch off into some of the arteries, drop down quite a bit more by the time we get to arterioles, and then by the time we get to capillaries, it's going to go down really, really far. Well, at the same time, area is sort of tracking this in the opposite direction. So relatively small area of aorta, more area of arteries, more area of arterioles, and then eventually capillaries, huge area, and then it kind of reverses itself again. Okay, so we can see our pattern of blood flow from arteries to arterioles to capillaries to venules to veins, and then back to the heart. Veins and venules have a different structure altogether than what arteries and arterioles do. Much thinner layers of elastic tissue, thinner layers of smooth muscle, and so it's kind of easy to imagine why this might be. The blood in the veins is coming out of the capillaries, so the pressure is going to be relatively low coming out of the capillaries. They don't need to have the investment in really strong tissue to help withstand the forces of blood coming out of the heart, because the blood in the veins is relatively low pressure. The way that the blood actually gets from the veins back to the heart involves what are called venous pumps. Since there is no second pressurizing mechanism by the time the blood comes out of the capillaries to get it back to the heart, we really are at a bit of a disadvantage here when it comes time to get blood back to the heart. But fortunately, we have skeletal muscles that surround some of these veins and venules, and through the contraction of skeletal muscles, that's going to allow the flow of blood back to the heart. That, coupled with these one-way valves that we see here, we have a section of vein down here on this picture. We have skeletal muscles that can contract, and as they contract, are going to help force blood up. The reason why blood doesn't go backwards is because there's a valve here that prevents backflow of blood. And then when these muscles relax, again, the pattern kind of repeats. When they contract, the pressure of blood inside this section of vein is high enough to open up the valves. When these muscles relax, the valves close and prevent backflow of blood in the other direction. So we have to have a bit of movement by skeletal muscle, contraction skeletal muscle, to allow for blood to flow back toward the heart. So again, smooth muscle is less, elastic tissue is less, thinner walls overall than arteries, but we do have the valves and we do have the skeletal muscles to help move blood back to the heart. So we see in this picture here a relaxed calf muscle versus a contracted calf muscle. What happens to a vein running up through the middle of it? Over here we've got the muscle contracted. We're opening up this one-way valve, closing this one-way valve, so forcing blood only in the bottom to top direction only. All right. Let's see. We've seen blood flow affected before by the endocrine system. We've seen neuromuscular reflex. We've seen hormonal reflex. We've seen chemicals like prostaglandins and so forth. All of those kinds of things can affect blood flow and how blood transitions from one section to the next. So we're not going to go into that too much more. We have seen that quite a bit already. So we're going to kind of move on here and just kind of end up talking about the lymphatic system. So now the lymphatic system is kind of the other half, sort of the circulatory system. It consists of its own set of lymphatic vessels, kind of analogous to what would be arteries and arterioles, capillaries, veins and venules. But now in the lymphatic system, we also have lymph nodes, which are places where lymphatic vessels come together. So if we look especially at the armpit and in the groin as well, there tends to be a lot of places where lymphatic veins come together. And wherever they come together, wherever they join up, like an intersection, that creates a lymph node. It's sort of a swelling of the lymphatic system. The thymus gland, which is above the heart. We talked about the thymus and production of thymosin back in our chapter on the endocrine system. And also the spleen here, which is involved not only in recycling red blood cells, but also some immune function as it pertains to the lymphatic system as well. So as far as functions of lymphatic system, we have the one I talked about already. We're going to collect all that fluid that's leaked out of the circulatory system. And since we need to have to get that back to the blood, to the heart, into the blood, we're going to use the lymphatic system to do that. We also have some fat transport. When we get to our chapter on digestion, we're going to see that once fatty acids are absorbed by the intestine, they have to travel in the lymphatic system to the liver before they can eventually get into the circulatory system per se. And then we also have immunity, especially when it comes to the lymph nodes and the thymus gland and the spleen. Wherever you see lymph nodes, wherever you see these intersections of lymphatic vessels coming together, there are almost always going to be collections of immune cells there as well. And so it's kind of like a security gate. It's a point of intersection, like on a major roadway, where you might see a security checkpoint, a DUI station, something like that, where they're trying to get as much traffic as possible. When you have limited resources, you want to set them up where roads come together, or where, in this case, lymphatic vessels come together. So wherever you see lymph nodes, you're going to tend to find more immune cells. And of course, when you get sick, your lymph nodes are going to swell up because they're going to be in possession of more immune cells to try to fight off whatever pathogen is causing you to be ill. Lymphatic capillaries are what we describe as being dead end. So we see here in this picture, we have an arteriole, precapillary sphincters, capillaries, venules, and eventually onto veins. But surrounding this network of capillaries especially, because that's where you tend to get the biggest leakage of plasma and fluid out of the circulatory system, there are lymphatic capillaries. And these lymphatic capillaries can pick up any fluid that might have leaked out of the circulatory system, get it into the lymphatic system, and from there sort of funnel it back into circulation at the heart. These capillaries do have valves, so again, there's no lymphatic heart. There's no equivalent of the heart and lymphatic system like we see with the circulatory system. So again, we're dealing with valves here. They're going to help make sure that lymphatic fluid only flows in the correct direction as much as possible. So that's going to allow us to move fluids and particles, pathogens if they're present in the blood as well. Those can go into lymphatic capillaries and gradually work their way into bigger and bigger lymphatic vessels until eventually they get into circulation itself. These lymphatic vessels are, again, fairly similar to what you see with veins. We see in this picture here a lymphatic vessel. We see a one-way valve. So the flow of material in this particular case would be from left to right. As this were to be squeezed, say by skeletal muscles, muscle contractions, the fluid's going to go from left to right. If the pressure is high enough, it's going to cause these two valves to open up. And as soon as pressure drops, this valve is going to close, and now the fluid is trapped over here in this section. And so over time, progressively, the lymphatic fluid can flow in a given direction. Now, what we're actually looking at here is not an inconsequential amount of fluid that we're dealing with. It works out to about 3 to 4 liters of interstitial fluid per day that's returned from the tissues into the circulatory system. So 3 to 4 liters is a lot. That's like two 2-liter pop bottles, which is a huge amount of fluid that's coming out of circulation, going into the surrounding tissues. And if it's not returned back into circulation, it's going to collect in the surrounding tissues and cause some major swelling and edema and those sorts of things. If you've ever seen images of individuals who have had elephantiasis, elephantiasis is a condition caused by a nematode parasite. It is carried by mosquitoes, and that particular parasite causes blockages to the lymphatic system, and the result of that is that fluid can't get back to where it needs to go. And so you see some very excessive edema and swelling, usually in the lower extremities because gravity is also working against you there, to the point where individuals become disfigured because they've taken on so much fluid in those parts of the body. Eventually what's going to happen here is this fluid's going to go back into circulation at a point where what's called the thoracic duct hooks up with the vena cava, and of course from there it's right back into the right atrium of the heart. I mentioned elephantiasis a second ago, not a real pleasant picture here to look at, but again, these are roundworms that get into lymphatic vessels, and as such, they can cause some extreme swelling in the lower extremities, very debilitating as that fluid collects down there in the legs, lower extremities, if you don't get that taken care of. Typically, that occurs only in tropical regions, certainly not a condition you find in the U.S. It's more of a African or South American sort of condition where you might end up with something like that. We talked about dietary fats a few minutes ago as well. Small intestine has the ability to pick up fatty acids as they are broken down, split apart from the larger lipid molecules that they were comprising. Lymphatic fluid itself can be upwards of about 1% or so of what are called chylomicrons, or fat transporting particles, to help get those fatty acids toward the heart. These are going to be too big to get into blood capillaries, but in this case, they can go in the lymph until eventually they get into general circulation. So again, the idea here is there are carrier molecules for these fats to help them travel in the lymphatic system until eventually they can get into the blood. The fatty acid molecules are too large to get into capillaries directly, so they have to find kind of an indirect way to get into circulation at the heart as traveling as part of the lymph. A couple of other things here. Tonsils are connective tissue in the throat typically, or obviously, where you find lymphocytes, which can be involved with immunity. They can be involved in killing off both bacteria and viruses. Of course, tonsillitis is a situation where the tonsils themselves become infected, and of course, at that point in time, the most common response would be to go ahead and have a tonsillectomy or have those tonsils removed. We talked about lymph nodes before as well. Wherever lymphatic vessels come together, there is a lymph node. And again, there tend to be a lot of immune cells here where this lymphatic fluid can be screened or analyzed for the presence of any pathogens or anything that shouldn't be in there, could then be attacked. So of course, when you're sick, you go to the doctor, they kind of poke you and prod you in your neck or maybe in your armpits to see if your lymph nodes are swollen. If they are, that's a pretty surefire sign of infection if you do have inflammation there in the lymph nodes. Talked about the thymus before with lymphocyte development. We talked about that back in our chapter on the endocrine system. We mentioned how that tends to decrease in size with age. We've seen the spleen before as well, but now instead of the lymph node function of the lymphatic system, spleen is sort of like a filter for the circulatory system. So in particular, we're going to have worn out red blood cells filtered out of the blood by the spleen and then recycled as much as possible accordingly. So we have breakdown of red blood cells as well in the spleen. So that's about all we're going to see here in the circulatory system. I'm going to wrap this up here and we will get into the respiratory system.